So I'll talk a little bit about Latinos in healthcare. Again, underserved population, some of the things that we really need to consider just in general healthcare are historical factors. Again, these are not just U.S. history, but we're also looking at their country of origin history. Language status, I'll talk a little bit more about that in a couple of minutes. Educational level, Latinos have the lowest rate of high school graduation, and there are programs in place now to help them stay in school. One of the primary reasons that Latinos do not graduate from high school is because they stop going to school because they have to work and they have to help to support the family. And education, unfortunately, is not one of the primary goals of coming to this country. It's usually working, and so education kind of takes a back seat to that. I think I saw a study that was done. It was actually pretty impressive that looking at medical school, and I think it was maybe a few years back, and so they had the rates of whites, of African Americans, of Latinos, and Asians that enter medical school, and it was something like 40,000 for whites, 20,000, going down the line, and for Latinos it was 400. So maybe 400 a year. Will either start medical school, but you can imagine that it's a lot less that actually graduates. So underserved population, we don't have enough Latino professionals out there to actually help to treat the population. Occupational vocation is a big deal. Again, California was a big base for agricultural work. I myself grew up with a family that constantly went back and forth between Mexico and California following the jobs. So there was, you go to a seasonal job during a certain time of year and then, go back to Mexico for a little bit and then find another seasonal job. My grandfather, for example, worked in the shipyards in the wintertime and then worked in the fields in the summertime, and then spent a little bit of time in Mexico trying to get back to his homeland. Health is related to socio-demographic conditions of age, education, immigration status, occupation, and genetic factors. And this is the case really with any cultural group. This is not specific to Latinos. Latinos have a lower mortality rate, but they are at greater risk for chronic illness and disease. However, they spend less days in bed because of illness. So, kind of interesting stuff there. So they might have chronic illnesses, but they don't spend a lot of downtime because of these chronic illnesses. The positive health indicators for Latinos include levels of smoking, so there's lower rates of smoking amongst Latinos, and illicit drug use, and a strong family structure. However, the longer that they spend in the United States, these positive health indicators actually deteriorate. So you see higher rates of smoking, you see higher rates of drug use and abuse, and you see the family structure falling apart. So that happens as people start to integrate more into American culture. For Latinos, they often combine traditional healthcare practices with Western medicine. This also depends on what they can afford. So it's not common for people to go to the doctor as the first line of treatment. Part of it may be because they don't have the insurance, and the second part may be because it's just not a custom. Usually it's, you ask your neighbor what they think might help, you ask your uncle what medicine they have, you kind of go through your community sources first before seeking medical or Western medical interventions. And it's not uncommon, I'll talk about this in a minute, but it's not uncommon to have more of these traditional therapies, herbal therapies, a mixture of a tea, you light a candle, you have some vitamins, you do things that are, I guess considered kind of a complementary alternative medicine, but depending on what the cultural beliefs are. Latino beliefs in general are a combination of Spanish with Hippocratic Galenic, so kind of the medicine that was brought over, and then Arabic medicine. So what Latinos usually practice now is a combination of all of these. And then the indigenous beliefs were merged with colonial Spanish, including the Mixteca and Azteca Indians. So these are just some visuals here. You'll see the one here is a botica, very common to see. You might even see it within a subset of a mercado, a Latin store, a grocery store, and usually it's filled with different kinds of herbs and roots, tinctures, vitamins. I've heard a lot of people, my patients, and then even personally, that they have a range of treatments that they're using, usually not medicine, but it's, I'm taking, this vitamin for this because somebody told me it helped, and I'm, doing a tincture of a root because I know it can cure this other thing. We don't have the science behind it to back it up, but they believe it works, and in some cases it does work for them. Also the combination of the religious aspect, having an altar, putting up some candles, having flowers, having that aspect of it is very important. And then some of the traditional medicine, actually, this is a lady that's doing a treatment for empacho. Empacho, and I'll talk about this in a minute, is a condition that you see a lot amongst kids. And what it is in the medical world is you overeat and you get a stomach ache. But they get constipated and get a stomach ache and there's a lot of pain. But amongst Latinos, empacho is considered a serious condition. And they usually have someone in the family usually knows how to cure empacho. And what they do is they lay them down, give them a nice little massage, and then usually pull the skin up so it kind of pops and loosens things up. Maybe a special tea, a couple of other things, and then the empacho's gone. I just recently went to see my grandmother, and I was telling her that my son was having stomach issues, and she said, "Oh, well, you know the cure for empacho. Why don't you just give him the massage?" I said, "Oh yeah, I'll go ahead and try that." And I didn't, but he got better anyways. It's also the common beliefs that health is holistic, which is a key component to treating Latinos. And I'm hoping that that's where Western medicine is going, is looking at people as a whole instead of separating body parts from mind, body, and spirit. And there's common beliefs, and this comes all the way back from the Mixteca, Azteca, back from the indigenous beliefs, that health is actually holistic. And there's an inherent need for humans to seek balance in life. And moderation, it's not healthy to go overboard with anything. And then the other thing, it's the focus on performing one's duty. So there is this very strong sense of duty, and this is where that, working until my body gives out comes in. My duty is to work, my duty is to provide and to do X, Y, and Z, and if I don't have that balance, then things can get out of sorts. Illness is considered to be an imbalance in the physical, social, and spiritual aspects. And the cause of illness can be supernatural, it can be magical, it can be natural, or a combination of the three. This is another quote from one of my patients. "I learned as a child from my mother, we weren't used to taking medications, maybe vitamins. Only if it was really strong pain should you take medication." Another key aspect of Latino health beliefs are the four humors of the body, and this goes back to even the Hippocratic belief system, or the medical belief system. The black bile, yellow bile, phlegm, and blood, they're all thought to determine temperament and personal characteristics. So there's a certain description, temperament description for Latinos that is related to this, and it's actually considered kind of a bad word, but if you call somebody this, it means that they're kind of, irritable, they're angry, they tend to be kind of a nasty, mean person, and it's all related to the four humors. There's also a significant relationship between hot and cold, and this includes everything from eating hot and cold foods together to being exposed to hot and cold. I recently had a patient tell me that her mother developed diabetes because she'd been in a car accident and then she took a hot bath afterwards. So the shock to the body and then going into heat, in their family, they strongly believe that that's what caused the diabetes. So I asked her, is this something that runs in your family? Does anybody else have that? Oh yeah, well my great-grandmother has it, and so-and-so has it. Okay, is it possible that it's, oh no, it was the car accident and because she took a bath afterwards and now she has diabetes. So there's a very strong connection. Another thing that I've heard actually quite a bit, and sometimes I think about it myself if it's true, is if you're doing a lot of work with your hands, you shouldn't wash your hands right afterwards, because if they're warmed up and then you wet them, that can actually cause arthritis, believe it or not. I don't know if there's any real backup for that. I haven't found any literature that says if you wash your hands after you do a bunch of typing you get arthritis, but who knows? They've believed this for centuries. There may be some significance to it. Some syndromes, some cultural bound syndromes, and you've probably seen a lot of this, especially the DSM includes these. Humoral imbalance, as we talked about, and this specifically is, if somebody's very angry, they might be considered to be increased in the bile, so you'll see more of that, the yellow bile. Empacho, as I talked about. Mal de ojo is evil eye, so this you'll see a lot of Latino babies have what's called a deer's eye on a red string, and that's to protect the evil eye. And susto. Susto is very interesting because I think it's very much related to our understanding of PTSD. So you can have somebody, be in a situation where they were, susto actually means scared, being scared. So you can have somebody who faced a very, a scary situation, and then they develop symptoms of maybe being dissociated, maybe having kind of these flashbacks of being anxious and withdrawing, and they consider that susto. Now, susto, the best treatment for among Latinos is to actually see a curandero, to see a spiritual healer to help take care of that. Now, if we think about it in terms of the traditional, psychological foundation, psychology was thought to be the study of the soul. So then a lot of the psychological issues that would happen back in the indigenous times were cured by the healer or the curandero or the witch doctor, and they usually did a combination of talk therapy, maybe gave them a little bit of some kind of herbs, they rubbed an egg around them or did this combination of treatments that was holistic. And it could be that all they needed to do was just talk about their problem, but they were set up in their own health belief system to have that included. You went to one person and they took care of all of it. Here's another quote. Because of traditions that have been followed for generations, you go to the huesero. Huesero is kind of like a bone doctor, kind of like a chiropractor. They adjust your bones. He'd pull your leg, he'd pull your fingers, he'd put your face down, he'd crack your back, he'd stretch you out, and you'd end up good. You learn from your family, like traditions, like inheritance. If your mom takes you to a huesero and makes you drink oregano tea, that's what you do. Expressions of illness. The more current idea of how Latinos express pain and illness, and a couple of studies that were recently done, one by myself and one by Yvette Flores, is somatization is actually very prevalent in Latinos. Now again, this is somatization as we understand it in the U.S. culture. If you go to Mexico, you go to Latin America, it's not even a valid thing. What is somatization? And this is primarily because Latinos are less likely to separate between mind and body, and they're more likely to experience emotional distress physically. And then somatization might also be less stigmatizing than suffering from an actual emotional or psychiatric disorder. So it might be easier to say, you know what, I have a headache, or I have a backache, but really it's because there's some kind of emotional distress that's going on.